Some say he's a technical whiz. Some say he was born in Cornwall. While some say he's on a journey. It's The Journey, and here's your host, David Hackett.
I have on another journey, and this journey's gone back a bit because the first time we recorded, and I'm not going to put it in the edit because it sounds funny, but because it was robotic, and we were talking about robotics and AI, the AI and robotics got to the better of us when we last spoke. So we are interviewing Charles. Charles is a patient advocate and CEO of HiDO Health, and it's about their simplifying the patient journey. Their mission is to help patients thrive at home, live healthier and happier lives. Most chronic care patients can maintain good health if adequate support is delivered in the home care setting. This shift of integrative care will swing the pendulum of healthcare from hospital to home care. And HiDO has the ability to create the most unique data sets for drug outcomes based on real-world evidence among at-risk populations with chronic diseases. And he's talking about his project, and hopefully we'll make sense of it with no robotics, no blurs, no nothing. Welcome back, and I will say welcome back, Charles, to the journey.
Thank you, David, for having me back again. I appreciate it. I think having a couple edits of the last conversation would be very fitting.
I might put it in as what went wrong at the end, you know, when they do the outtakes. So I might add that at the end.
Yeah. Well, thank you so much.
It's okay. Now, journeys begin. We understand that AI is only just starting to develop, as we discovered in recent weeks. It's like AI is now becoming virtual reality. Like Apple released, you know, I think they've now released it, but they're going to release a virtual headset where you can actually use it instead of phones. But we're not talking about phones, we're talking about healthcare. But AI has developed over the years because of advancements in technology. Example given, you go into an operation, gone is the day where they cut you open and, you know, you got your body open, you go through keyhole surgery, which is less invasive. So talk us about your project that you're working on currently that we spoke about briefly. Well, we did speak for half an hour about it, but talk about your project.
Yeah, so HiDO is an AI-assisted robotic device living in the home. And this helps people that have chronic care diseases and assist them with their daily medications. The HiDO stands for Health Information Data Outcomes, and a user walks up to the unit, it unlocks based upon their face, it dispenses the right medication at the right time, the right dosage, the right frequency, and the right count, and then you take the medications and then put them down. And as I see it, there's really three pillars to health. One is your diet. So it's the matter of the nutrition that you put in your body. Two is the amount of exercise you get or lack of, like we're sitting right now. And then finally, if the first two, you have challenges controlling those, ultimately what happens is as we get older, we tend to present with a variety of different disease states. And that is where number three comes in, which is the medications. So if you have poor choices with nutritional habits, eating Cheetos and some other products, maybe some hot dogs at a baseball game or going to a football game, having some beers, and then two, sitting down for hours, and then ultimately present with cardiovascular conditions or diabetes, that's when the medications can smooth them out.
And you're talking about how technology is and how it helps dispense medications. It helps a lot because you know, people with chronic diseases can't physically always open up bottles manually. So this is a good way of just, like you said, you use your face, it recognizes your face, it will dispense your medication. I assume it's multiple user So it could be adapting, it will know your face, it could know someone else's face, or was it just set for that individual?
Yeah, so currently right now, we limit the technology to one user in a household. Ultimately, in the future, you might be able to have multiple people within the household dispense medication. So let's say that there might be somebody a little bit older, maybe somebody a little bit younger that needs some medications. Well, you want one person taking one series of meds and one person taking a series of other medications. So that type of technology exists. Right now, we're solely focused on chronic care disease states. So people that have cardiovascular disease or folks that might have some memory issues like dementia or diabetes, or there's a variety of other different disease states that we can serve.
And I assume it will remind you so you won't automatically forget, because obviously people will say technology, surely how will that know when your medication is? I assume it will remind you.
Yes, there's a couple of unique technologies with this HiDO device. One is, yes, you'll get a series of reminders, and we like to think of that as behavioral modification. So based upon your habits, it will alter your course in order to make sure that you are healthy at home. And that's important. So not just getting text messages and, the device talking to you, there's a cascade of effects that happen. So let's just say, David, that you're supposed to take a series of medications because you have seizures. So if you miss these medications, that's very important. And you've already gotten a series of text messages. Well, we have a cascading clinical intervention that will happen if you miss. So you miss those messages, then they go to your loved one. Then they call you and say, "Hey, David, are you okay? I want to make sure you're taking your medications."
Yeah, and I just like that because it's that knock-on effect that it will be always something there to remind you. So we did touch upon about the technology, how it works, and you did say about a situation where it would automatically will help you for the benefit. Now, I assume that you get with the patient in this scenario, or I don't want to use the word test subject because I know you're in the early stages, but it is a beta test. But do you feel like the results that you've seen so far have been beneficial to the project?
Yes, well, actually, we're past beta. We have done a number of different NIH funded clinical research with Stanford and Rush University. So Stanford was with HIV patients studying antiretroviral impact to their viral loads, and as a secondary impact, were their diabetes A1Cs also being lowered. And then at Rush University, we actually are studying patients with mild to moderate dementia, walking up to the unit, setting it up, and dispensing it. So I want you to sit back and really think about that. A patient that has dementia is able to set up our device, dispense, go up to the unit, and actually remember how to do that. So that type of technology has never been seen in the marketplace. I believe can have a significant impact on millions of lives.
And I'm not, I'm saying your device is unique because I have seen it on various sites, and I'm not exactly remembering the company. You do get companies that offer automatic pill dispensers, but it's not the same as your device because yours is the unique approach where it would recognize you. This one's like just holds out something and it will give out the right medication. So yours is in a unique market because of how it recognizes you for you.
Yeah, we have a couple of unique technologies that are integrated within this device. There are other devices that do dispense pills. What we do is we actually capture the full chain of custody. So what that means is that when the medication is dispensed from the pharmacy, it's pushed into the device. And when it's pushed into the device, we have a specialized cap that auto recognizes medication dosage, frequency, and pill count. So similar to like a Keurig coffee machine where you put the pod within the unit, you press a button. Within our device, when you put your individual caps inside the bottle, the device will actually recognize all your medications, push it to your phone, so you don't have to organize anything anymore. In addition to that, once it dispenses the medication, we have tracking so we understand a thing called remote direct observation therapy, which is a fancy term for video recordings. So from the beginning to the middle to the end, we capture everything. And by capturing it, what is able to happen is a substantial reduction in hospitalizations, ER visits, and more importantly, it impacts human life for the better.
Yeah, and I just like that because of that advancement. And all you saying about it going into the machine, it will recognize. I assume it's like a timestamp. It will read the label and it will automatically will know that from the label, or is it just everything that's unique to
Yeah,
the?
so yeah, we have an electronic transmission. We have embedded RFID chips within each cap, so that transmission of data goes back and forth from the device to the cap, and that's what makes it very unique. So that is patented technology from HiDO.
And talk about IDO. How was the early stages of the development? Because obviously you had to start somewhere, and obviously you had a machine. But how was the early designs of the machine compared to what it is now?
Oh, substantially different. So what you're seeing in my background is version 4, and you can see one of our patients actually going up to the unit and taking the medications. But it started with a drawing, and my hieroglyphic artwork is not anything to put up on the wall. So I described what I wanted from my vision to my daughter, and she's a talented artist, and she actually drafted what it looked like. So when we first started, it was pen and paper or pencil and paper, and then we slowly iterated from one device to the next to the next. So we're very excited about what we have right now, and we're looking to impact millions of lives.
And I assume version 4 is the one that's going to be sticking more, but obviously as technology evolves, you'll work with that technology as well.
Yeah, the version 4 is actually pretty advanced. We have a number of different integrated features. We have 2 different cameras. One's an IR camera, which is infrared. So depending upon the lighting or the skin color, we can recognize people. So what's interesting about our technology is the room could be pitch black. You could walk up to the device, put your face, and it'll unlock it. So there are some unique technologies that we have and some sensors that I believe will be, it'll take a number of years before they are shelved.
Yeah, and obviously there will be concerns, and because people say, isn't it dangerous to have infrared on this face? But they forget half the time if you're around that person, your phone, if you've got an iPhone that uses Face ID, that doesn't hurt your face. It picks up I forgot how the words were and Apple announced it, but it uses your face and outlines. It's like the virtuality headset. Like I told you, they're using that for the new headset. It
Mhm.
prints your face. So I assume this is similar.
Yeah, it's the same type of technology that mobile camera manufacturers use. So it's an infrared lens that's placed over the camera, and that's not unique. That's ubiquitous throughout the marketplace.
Mm. So going forward to the future, and obviously we have touched upon it in a way, but technology will evolve. Do you feel the evolving of the machine again will help it for the future development of it?
Yeah, I mean, technology advances very quickly. I mean, you have a lot of um, AI chatbots right now, and I believe AI robotics can alter the way that we live in the future. Now, once you set the ecosystem in the home and you're able to stabilize a lot of these types of disease states, I believe that can alter the course for many millions of people because you're changing the behavior. So what it really comes down to is people's behaviors. And you go to a hospital or you go to a physician or a nurse, and they've been medically trained. And these are exceptionally complex instructions and medications that are too much for a lot of people to handle.
Mm,
And I believe just by integrating, different AI technologies within our life, it can help bring up a lot of folks that potentially would be left behind. So I think the future of AI is going to be very exciting.
yeah, I do believe that as well. So, and I remember you liking this last question. What thoughts and words would you say to people to help them feel more comfortable, more reassured for if they were to take this on? And I'm not saying this is a product placement, how they would, but what would you say to them to make them feel good about the way forward for their health with your product?
Yeah, I think that's it. That is a good question. When using a product such as this, I think it really comes down to lifestyle choices. If you're concerned about your loved one or yourself or your family member or friend, there is a better way to help them. Right now, essentially people are on their own or they might have access to a caregiver, but this type of technology gives independence and freedom for people so they can care for themselves without having to rely on others. And that type of emotional lift that it provides people, and you can see a lot of videos on our YouTube channels, is substantial because they know that they can care for themselves. They just need some help.
And last of all, how can people get in contact with you about this?
Yeah, you can visit us at HiDOHealth.com or go to our YouTube page. Just search up HiDO Health on the search query. We just came out with a documentary film. So if you want to see the journey from the beginning to where we currently stand right now, it's about 20 minutes. Would love for your viewers to watch the documentary and learn a little bit more about HiDO.
For people watching, I'm going to put the descriptions on the up above, and I'll make sure I put it in the link and description below for anyone listening. But Charles, even though we had our technical difficulties and we finally got there, thank you for being part of the journey.
Thank you, David. Appreciate it.
Thank you. And for those people who wanted to, and Charles will agree to this, anyone want to see a sneak peek at what went wrong last time? After this, it's a 10-second highlight of what went wrong. Thank you.
Yes, kids flying planes. So as a 10-year-old, I was flying planes around Southern California, which was a bit odd. But for me, it was normal because that was the environment that was surrounding me. So I was able to do some very exciting things at that time, but not realizing until later in life what I was doing, which was
That was The Journey, hosted by Wise Words Imaging, hosted by David Hackett. Be sure to like, subscribe and listen to another journey coming soon.